Welcome to this edition of the eClinicalWorks podcast. I'm Adam Siladi, and we're broadcasting to you from the eClinicalWorks National Conference 2016 in Orlando, Florida. eClinicalWorks has been a long-time leader in the ambulatory EHR space, but we're now developing offerings to be used specifically in an acute care setting. And we bring our technical expertise to partner with some people with the clinical and procedural expertise. And that's why Millie Shinn is here with me today to discuss that. Millie, thank you for being here today.
Thank you for having me.
Now, Millie, you're the Director of Clinical Informatics at Hamilton County Hospital in Texas. Tell us a little bit about your organization.
So we are a hospital-based RHC. We have 3 clinics that span in 3 different locations. There's 12 providers total. We're also a 42-bed PPS hospital, so we're one of the smaller hospitals, but still not critical access. 10i, new product, obviously, and you are our development partner, and that is not something that just anybody gets to be part of. Tell us a little bit about how you came to find yourself involved with it. Yeah, I think we had this discussion earlier. I'm a little pushy. So we ended up going to the conference last year. They made the big announcement. Girish said there was going to be an inpatient product. There was about 3 or 4 of us there that were from our facility, and we decided that that would be game-changing for us, a unified EMR. So I went down to the 10i booth, skipped a session. But it was okay. I've met Renil's lead development for the product, and I asked him to show it to me. And I watched it. It looked great. There was a few things I thought we could improve. And so I gave him just a little bit of feedback right away and went back, talked to all of my coworkers, and we kind of brainstormed how would this affect us? How would it affect our users? And so we decided, I think we want to look at it again. And so I went back the second day, and I looked at it again, and the third day. And by the third day, Renil and I had kind of built a rapport, and so he brought Girish in, and we talked, and Girish and I and Dr. Rudolph, one of our doctors, agreed that this was definitely something we wanted to move forward with. So they sent us a letter to commit to the project.
Well, it doesn't sound like you were being pushy. It sounds like you were being helpful, so I wouldn't say pushy. But I've heard you're also the leader of a Google user group.
I am. I have a Google user group. It's currently our existing vendor, but we're opening those up. There's about 270 users that are all clinical in background. And so you may have a pharmacist, a lab director, informatics people like myself. And so it's really kind of throwing around the ideas of healthcare IT and pain points and how other people are solving those problems. And
let's talk about some of those pain points. With your current configuration, your current setup, what are some of the pain points that you face?
So we have 3 EMRs. We have one in our ED, one in our 3 clinics, and then one in our inpatient system. So when you've got 3 EMRs, you've got 3 usernames and passwords. You've got the patient's home medication list has to be re-entered 3 times. So you lack that ability to really create a seamless experience for the user or the patient. And so we felt like those were things that really mattered to us.
And that's not an uncommon situation, especially in a hospital setting. You've got
Right.
lots of different systems designed for different things that probably came online at different times, and now
Yes.
you're trying to get them all to talk to each other.
Yes.
It also sounds like maybe there's some patient safety issues there going on there with
Yes.
when you have to duplicate the information across multiple systems. One of them might get missed
Correct.
or entered incorrectly. So how do you think that 10i will solve some of these problems?
It changes everything. I think that for us, the ability for, just the end user experience, when they've got one system and all of the information is at their fingertips, regardless of where they work, it's the same system so they can access that information from anywhere. I think that as a nurse, to me, the med list, entering it once and not having to duplicate that process is safer for my patients and it's easier for me. And then upon discharge, it'll be readily available to the next clinic visit. So that information is already there waiting on us.
Why do you think people don't have that unified system already?
Cost. I mean, we're a small hospital, so cost is everything to us. And in the past, the unified EMRs like Epic or Cerner, those are expensive. They're not cost effective for a small facility. And so last year when Girish said that, he really wanted to kind of disrupt the market and offer something that was scalable to where we should never have to sacrifice our patients, safety or experience or our end user experience just because we can't afford it. And that was something that Girish kind of committed to then, that he wanted to offer something that everyone could afford and give their patients the exact same offering.
Are there any functions or
modules or anything like that you might have been working on that you know are distinctly different from the ambulatory to the acute care setting? Messaging, for example, or anything like that?
So one of the things that we've kind of talked with ECW about is that, whenever you're in the ambulatory setting, someone's sitting behind, a desk, or they're on their iPad pretty, commonly, frequently. But for the inpatient setting, we're down in patient rooms. We're not sitting in front of a desktop. We're not sitting in front of an iPad. And so whenever you want to communicate with physicians or patient family, anything like that, you need to be able to push that information out. And so we think that the ability to send someone like a text, a secure texting app, or something that will send that information to the doctor and alert them to where they're like, okay, I have information I need to handle. And so I think that's something that we're really looking forward to changing for us.
And certainly we've seen some pretty cool features come out with regards to messaging from everything, not just the clinical members that you're talking about, but also in the inpatient setting you have housekeeping,
Yes.
Transportation, bed management, that kind of thing, and that messaging can communicate with all of those parties
Right.
in a unified way. So let's talk about this development process. When you had a close contact with Ronil and the development team, but what about looping in some of the other people in your organization? What kind of information and feedback have you gotten from
We
them?
made a concerted effort. These are the people, we've engaged all of our directors. So the lab module is being developed by our lab director. I mean, we've made sure that these people were engaged at the very beginning levels, because when this transition happens and we try to change over, we want to make sure that they feel like they were engaged in the process. So we've had all of our directors involved from the very beginning. We meet about monthly and talk about how things are going in the project, how they're feeling. I sent out a survey about a month ago because we're almost a year in now. And so sent out a survey just to make sure that they're still feeling okay with the project. I think we have 22 directors. We're pretty small. I sent it out to 22 people. I got 19 back. And one of the questions was, is this making your life easier or harder? Are you indifferent? And all of them across the board said easier. And then as far as that, how excited were they to make the transition to the new product? 5 was super psyched and 0 was not at all. And I had all but 2 were super psyched. And they were 4s. Like it was 0 to 5 and they were 4s. So I was like, okay, close.
That sounds like a very excited group of people. Now, when we come to implementation, still a ways down the road, but especially for something like an acute care setting, where you have a lot of different parties involved and a lot of people, it's a big undertaking, right?
Yeah.
And I'm sure it causes some anxiety. How do you plan to roll out that implementation?
We have a history of when we go live with something, we go big or go home. So I think that as long as we make it a super fun event, we'll have to see what we bring to the table. But I think there's going to be some sort of a large event that will last throughout the implementation phase. We tend to throw food and gifts at them, and it makes them happy.
Have you done what are some events that you might have done in the past?
We did a NASCAR-themed event the last time we went live, and so we had them, like NASCAR came in with a car that we got to ride in, and then we put all of our directors, their departments were able to make them their own race car. So my director, he got to wear a nice little tag and ride a tricycle. That was his race car that we made for him. So it was kind of fun.
That does sound like a lot of fun. Any thoughts on what you might be planning for the next one?
I don't know. It's hard. I think, we kind of topped ourselves out with NASCAR. We've talked about circus, or I don't know. We'll have to see.
Well, it sounds like a lot of fun, and maybe you can start a side business as implementation consultants for other hospitals, how to make their implementations fun. Well, Millie, thank you so much for taking the time to speak with us today. If you'd like more information about our acute care offerings, you can go to my.eClinicalWorks.com. And you can also check out our other episodes of the eClinicalWorks podcast on YouTube or on iTunes or on my.eClinicalWorks.com as well. For the eClinicalWorks podcast, I'm Adam Siladi, and thanks for watching.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.